The CDC is expected to approve updated COVID vaccines today at a time when COVID cases, have you heard? Those numbers, they're going up. But concern about the virus, that's going down. It's not good. In a new CBS News poll, just 45% of people say they were worried that they or someone in their family could get COVID. Now, that's down from 77% in April of 2020. And only 43% said they plan to get the new booster. And you can see these numbers do vary. That's according to people's political affiliation.
Crazy.
Dr. Celine Gounder is a CBS News medical contributor and editor-at-large at KFF Health News and joins us. This is not a political issue for many people. We just want to be healthy. So when you hear that these numbers, and you hear that the numbers, people are still reluctant to get it, even though they know COVID cases are going up, what do you think?
I don't think this is just a partisan question. I think a lot of people are just over COVID. They're tired of it, which I think is understandable. But there are certain groups that remain at increased risk over everyone else for hospitalization and death. Those folks absolutely should be going out to get the updated COVID vaccine. And that includes people over 65, people who are immunocompromised, those who are living in nursing homes, and two other groups people may not think about: pregnant women and infants. And what all these groups have in common is they have weaker immune systems and so are at higher risk for complications.
But why do you think this vaccine in particular is important for us to get?
This particular COVID vaccine, it's updated for the variants that have been circulating this year. It's not perfectly matched to the variants that are out there right now, but it's pretty close. And what we're seeing from antibody levels and testing, this should provide robust protection against the currently circulating strains.
Will people have to pay for this shot this time around?
If you have insurance, whether that's private insurance, Medicare, Medicaid, you should not have any out-of-pocket costs to get vaccinated. Now, if you don't have insurance, the Biden administration has set up what they're calling a bridge access program, where you will still be able to get vaccinated for free, but that won't start until mid-October or so.
A lot of people stockpiled COVID tests in the era of, like, you got to take them before you go into this and take them before you go into that and show them and take a picture and blah, blah, blah.
I know, Tony, I've got 20 at home.
Oh, and I bet you...
I have a cabinet.
I know I've got 20 at home.
And I bet you if you read the back of the box, it says it's expired, right? So can you use an expired test if someone wants one?
Yeah, so the FDA has extended expiration dates on some of the tests. So the best way to figure that out, because it does vary by brand, is just go online and search for FDA at-home COVID test expiration date, and then you'll come up to a page where you can look up the specific brand that you have at home.
And when are the vaccines coming out? And Moderna and Pfizer are both going to be releasing these updated vaccines. Does it matter to you which one you get?
It really doesn't matter. I would view these as interchangeable right now. The CDC is anticipated to make some recommendations later today, which really paves the way for a rollout. And we think that within a few days, vaccines will be available to everyone.
Right. I cannot wait to get mine, and I'm scared of needles, but I don't want to get COVID again. Dr. Celine Gounder, also you were in Morocco when the earthquake hit. Wow. You were not close to anything, but still it's got to be very unsettling.
Scary,
yeah, I was in Marrakesh, and you could definitely feel it, but you know, as tourists, you're not staying in those mud brick buildings.
Yes,
so
yes.
You know, you're a lot safer.
We're glad you were home and
okay.
safe. Thank you. To find out if your COVID test is good past its expiration date, we've made it very easy for you. Go to our website, cbsmornings.com, for a link to the FDA chart.